Imagine waking up tomorrow morning and the first thought that crosses your mind isn't, will it work today? It isn't, am I still the man I used to be? It isn't that quiet, nagging fear you've carried for years. Imagine that weight simply lifted. If that resonates with you, then I need you to stay right here, because I'm about to share a technique using nothing more than your own toothbrush that can literally rewire your body. In the comments below, just type the word present to let me know you're here and ready to take this journey. Also, tell me where you're watching from today. I'd love to see the cities and countries in our community. My name is Dr. Evelyn Hart. I am a board-certified urologist specializing exclusively in men's health. I've spent my entire career focused on helping men understand, protect, and optimize their sexual health. I've sat across from thousands of men. The struggles are universal, the fears are universal, and so is the silence. The silence around those struggles is the thing that causes the most damage. You deserve a doctor who actually sees you. Whatever you're experiencing, you are not broken. You are not alone. And there is so much we can do together. Today, I'll teach you a technique using a toothbrush to activate the erection command center in your body. This is not pseudoscience. This is grounded in neuroanatomy and clinical research that many doctors don't know. Let's start with anatomy. This area right here, between the base of your scrotum and your anus, is the perineum. I want you to think of it as your body's hidden control panel for sexual function. It's incredibly dense with nerves. Beneath lies the pudendal nerve, responsible for sensation, and the perineal nerve, which influences key muscles. These muscles, the bulbocavernosus and ischiocavernosus, pump blood and maintain rigidity once you're erect. Just millimeters away is the back wall of your prostate. When you stimulate it externally, it's a gentle massage. This increases blood flow and activates the same nerve pathways that trigger and sustain erections. In 2024, research showed targeted massage promoted pleasure and a 76.94% improvement in erectile function. We're talking about a dramatic shift in function achieved without medication or invasive procedures. By stimulating the perineum, you activate those same reflex arcs that tell your body, it's time to perform. The perineum is the external surface of your pelvic floor, a complex sling of muscles supporting your prostate. When these muscles contract, they squeeze the veins shut. Think of it like stepping on a garden hose to build pressure. As we sit for hours or accumulate stress, these muscles become tight or disconnected. Signals become sluggish. Perineal stimulation wakes up those nerves. You're reminding them of their job and increasing blood flow. You're triggering the bulbocavernosus reflex, which directly contributes to a stronger, harder erection. Right now, Stanford is conducting clinical trials on this. The medical establishment is finally catching up. Now, why a toothbrush? Let me be clear. This is external stimulation only. It never goes inside. First, the bristles. They provide differential stimulation, activating multiple types of nerve endings at once. Second, accessibility. Every man has one. It's completely innocuous, private, and costs nothing. Third, control. The handle gives you a mechanical advantage to precisely target the area comfortably. I emphasize, use a soft-bristled brush, not medium, not hard, and always ensure it is clean. Before the technique, we need to talk about safety. It's about creating the right conditions. Ideally, do this when you're relaxed and have privacy. Many men find the shower works beautifully. Empty your bladder first. A full bladder can interfere with sensations and cause discomfort. Lubrication is optional. Never use anything numbing. Pain is your body's signal to adjust. Your mindset matters. Approach this with curiosity and self-compassion, not as a mechanical chore. Do not do this if you have an active prostate infection, symptoms like fever or severe pelvic pain. Avoid if you have painful hemorrhoids or fissures. The proximity can aggravate these conditions. If you have prostate cancer or heart disease, clear this with your doctor first. Safety always comes first. Step 1. Find your perineum. It's the span between the base of your scrotum and the anal opening. Step 2. Get comfortable. Lie on your back with knees bent or stand in the shower with one foot elevated. Step 3. Explore with your fingers first. Press gently and notice what areas feel sensitive or neutral. Step 4. Introduce the toothbrush. Start at the very center with very light pressure. Just feel the bristles. Step 5. Make small, slow circles, about the size of a quarter, clockwise then counterclockwise. Step 6. Experiment. Some men like quick strokes, others need deeper pressure. Follow your body's feedback. Step 7. Add movement. Move forward toward the scrotum, back toward the anus, and side to side. Step 8. Integrate. Use your other hand as you normally would. You'll likely notice amplified sensations. Step 9. The W technique. Draw the letter W across your perineum to stimulate multiple nerve pathways. Step 10. Duration. Start with 2 to 3 minutes. Over time, 5 to 10 minutes may feel right. Step 11. Cool down. Rest, breathe deeply, and notice any residual sensations. This helps your nervous system learn. This isn't just about performance. Regular massage has significant implications for your prostate health. BPH affects nearly half of men by age 60. Massage helps drainage and reduces congestion. The pelvic floor is a storage site for stress. Massaging this area signals your nervous system it's safe to relax. Learning to touch this area with intention is learning to care for yourself in a way most men never do. For many men, this brings up embarrassment or shame. I want to give you permission to let that go. These are your nerves, your muscles, your pathways. They belong to you. Caring for them is not weakness. It is, in fact, courageous to set aside cultural conditioning and say, I am going to understand my body. The path to healing runs through the body. What might be possible if you fully inhabited yours? We've covered anatomy, science, and the technique to stimulate blood flow and awaken your response system. Now it's your turn. Knowledge without action changes nothing. Transform your health through practice. Here's my challenge. This week, try this technique just once. Give yourself 10 minutes and notice. Come back and tell us about your experience in the comments. This is how we break the silence. If this helped you, hit like, subscribe, and share this with one man you care about. Start a conversation. Tell me what you need in the comments. This channel exists for you. What topics should I cover next? Health is about optimizing function and honoring the bodies we've been given. You deserve to feel alive. I'm Dr. Evelyn Hart, and I'm honored to be on this journey with you. Be curious. Be brave. I'll see you in the next video.